not muted already. Shu-Ti will speak for a while. She'll show us some slides, and then there'll be a chance for questions and answers. And Shu-Ti will have to go to bed in an hour's time. So we're very grateful to have her for an hour. Thank you very much, Shu-Ti.
Thank you, Isabel, and dear committee members and colleagues. It is truly my great pleasure to meet you a little bit past the midnight here. So I'm going to share the slides, and okay. So I would like to talk about whether elimination is preferable and how, and share our experiences with you. I wonder whether you know, actually last year, there was one time in history last year that actually your daily instance has been very close with ours. However, after that one moment, then we went on into different directions. Okay, so I will show some comparisons regarding our pandemic status, our utilization of resources between Taiwan and UK. And then I will talk about what happened in Taiwan. What did we have to fight against this pandemic, and what happened last year that actually we underwent, to us, we saw it as a huge outbreak. But then we tried our best, and then we regained zero. I will show the process with you. It might be quite different from what you thought, okay? And then I will give some conclusions and comments. So first of all, the population size in Taiwan is about 1/3 of UK. And this is the cumulative mortality rate so far. So actually UK is here and Taiwan is here. We are you are 61 times that of Taiwan. So I often said it's one globe, but two words. Okay, two words. One word doing mitigation, the other word trying to contain the virus and eliminate. Okay, and this is the cumulative excess deaths. We know actually there is more than one pandemic. We have parallel pandemic that some people died from COVID-19, but some others died due to healthcare displacement. Okay, and actually for US, over the 2 years, they had in total over 1/3 excess deaths of their total cause of mortality. Okay, and UK, you have 27% excess deaths as higher than predicted, and in Taiwan actually due to the containment. So not only containing the COVID-19, but also the deaths from influenza, from other infectious disease were also lower. So we managed to have actually our total cumulative mortality rate actually was lower than projected. And this is the stringency index, just to show that countries doing mitigation actually were under higher scores of restrictions than countries doing elimination, zero COVID strategy. Because people tend to believe that elimination strategy is too harsh. But in fact, it's totally different. Actually, people who would not like to lock down were under lockdown for longer period. And actually different countries were making similar efforts to restrict the spread. You can see this picture showing effective reproduction rate over these 2 years. Most of the countries tried to to keep RT value within under 2, or most of the, whenever there was an outbreak, then they tried to reduce it to under 1, right? So why the outcome could be so different? I would say that the difference lies in the size of the spreading sources. So when you have a large size of cases, then even though you did a lot of things, still you continue to have some cases. And this slide showed the difference here. Taiwan last year, our daily instance was here, and UK, you were once lower than ours. Okay. However, after that point, you went up, and at that point we thought that's too high, so we did our best to get down. Okay. So the only difference is which way did we go. Okay. And you can see New Zealand and Taiwan, most of our time we enjoyed free lives. When we eliminate the virus, we enjoy the freedom. So the stringency score, that's a difficult word to me. The stringency score in Taiwan and in New Zealand, most of the time, is much lower than yours. But when it's necessary, we raise the intervention to eliminate the sources. So we only did it when it's necessary. But UK and US, you can see such a long time you were under very high degree of restrictions. And I argue that if UK tried to went further down, the outcome might be different. And this is the Google mobility data showing that actually, in addition to the government's interventions, people also made their own decisions. And you can see quite often your people might be voluntarily restricting their own activities. And in Taiwan, this period was when we experienced the outbreak. I will show you Australia's later. Okay, and actually, for example, in China, whenever there were community spreads, they did universal testing. They tested several millions of people within 1 week. But some people thought that, oh, that's a high value. No, we only did that once in a while, Taiwan, same. But UK, you see, you continue to do a lot of testings. So you did more, but you also suffered more. I'm sorry, I hope you won't mind, because I need to use cases to show to the government and our people. And of course, more people died and more people stay in ICU. And so the utilization of medical resources was higher among countries doing mitigation. And for I say it's the champions, Australia and Singapore and South Korea, they say, okay, now we have 80% vaccination rate. It's time we live with the virus. We are strong enough to live with the virus. Then what happened? This is Australia. Under Delta, they couldn't go over it. Then they open up, and currently that's the situation. And this is Singapore, same, and this is South Korea, same. And US, when Biden said, let's take the mask off, then okay, they experienced the wave higher, and the wave went up, and currently under Omicron, it's even higher. These are the daily mortality rate. And for UK, yeah, after the Freedom Day, the mortality rate went higher, and under Omicron, it was even higher. And Australia, they say they are brave enough to continue to open, okay? But see, their people, they were restricting their activities deeply, even so deep than before. So actually, people did not want to go outside, even though the government said, go, no problem, go. The people tried to protect themselves. Okay, so what did we have? So this showed you that in 2020, we tried to keep 0 domestic case. And in 2021, unfortunately, we had this outbreak. At that time, the mortality was 25 per million, but then we regained 0. Okay. And so what did we do? We had the lessons from SARS outbreak at that time, and I will show you actually the other weapon we have is the Communicable Disease Control Act, which gives the government full authority to mandate case-based interventions, including to test our people and to do contact tracing, everything, and to do public health interventions and to have inter-department coordination. Okay, and under SARS outbreak, I was the commissioner of Taipei City's health department, and we practiced universal masking and all those things. Okay, test, trace, isolate, all those things. And at that time, the only one thing we did not do so that we failed, it was the border control. We did not initiate border control early enough. And when you did not do border control, then you have community spread. And that's the most awful thing, because for SARS or COVID-19, the symptoms are too general. You wouldn't be able to tell them from common cold or other disease. So there will be a lot of missed diagnosis, and they will continue to spread. So it's very important to keep the community case number as low as possible. Okay, and at that time we had several hospitals infected, and we had to shut down those hospitals and one community. It was very heartbreaking. It was so awful. So we tried our best not to have community spread as our highest priority. And so this time we know, in addition to case-based intervention and public health interventions, we must close our door as early as possible. Okay, so and so this time we had early border control, very early. As early as WHO received the notification from China. From that time, that day on, we started the on-board health check, and then we raised the level of border control. Eventually, on March 19, 2020, when Western countries had also outbreaks, then we shut our door against every foreigner. Only citizens may return, and everyone who came to Taiwan must undergo quarantine for 14 days. It's we continue that until now. Okay, and we kicked off our Central Epidemic Command Center to have a commander with the highest authority to give order, and everyone must follow his order, and that's the health minister. Okay, and of course, with our hospitals, they established a very high degree of infection control resilience, and they continue to do those things, test, trace, and isolate, etc. And we linked big data with hospitals to identify inbound cases. But that wouldn't work if you have community cases. Okay, and our people voluntarily put on their face masks. This is something we appreciate to our people. That's very important to us. Okay, and however, sometimes the commander did not think things are serious, and actually he did not admit airborne transmission until recently. And actually, we had a very limited testing capacity, and that's one thing we worry. And previously, the commander only allowed testing on people with symptoms, and that's one problem. So then we have the breach from the crew members who did not have symptoms, and we have serious community spread. Okay, so we had this very constrained testing capacity, which is not appropriate against COVID-19, because COVID-19 spreads well before symptom onset, and many continue to be asymptomatic. And we did not prepare vaccines as early as we should have. Okay, that's also one thing. When we experience the outbreak, the vaccination rate is less than 1% in Taiwan. Okay, so we did many lousy things. And then, so what happened in last May? Okay, so because the commander relaxed the quarantine policy for crew members, so they brought the virus inside and spread to the communities. But then this slide showed you that immediately after several cases were identified, then local governments, Taipei City and the new Taipei City, which were the two epicenters in Taiwan at that time, they kicked off a lot of these arrows indicated their activities. They tried to do everything possible. So Taipei City and New Taipei City launched their community testing services as early as possible. And at that time, we only had PCR for testing, but then they used the donated quick tests from industry to do community testing. But anyway, they tried their best. And also they tried to shut down the schools. And the commander said, no need to shut down school, it's still early. But the two mayors, they wanted to do that. So they did the shutdown of the schools, and they even consider level 4 alert, which means total shutdown, including the shutdown of works. Okay, but then I will show you some details. We didn't need to say all those details, but just to show you that we had debates regarding, in addition to providing testing, whether or not should we practice lockdown, level 4 alert. Because I said this one is the op-ed I wrote. I said lockdown is like to freeze the community spread. So we should do two things. One thing is to freeze the spread. The other thing is to speed up the testing for eliminations. And then altogether, we can restrict the infection size as small as possible. But the government didn't want to do it. So then I called our people to do the quasi lockdown. I said, let's do it by ourselves. Let's start home working and avoid those public activities and avoid public transportation. Okay. And Yanir, the leader of the World Health Network advocating for zero COVID, also helped us to provide his opinion as an outsider. And you see that actually the two mayors, they wanted to shut down the schools, and our newspaper showed this cartoon that these two mayors were pulling the commander forward to do things earlier and quicker. Okay, and they were preparing for level 4, but it was very difficult for them because they worried that, you know, we have this semiconductor company which was providing the semiconductor worldwide, and they worried whether an order to stop working might interfere that. So very difficult. However, so our people, especially during weekends, they don't have to go to work. So you can see the road, the city everywhere empty. So since the first weekend and the second weekend everywhere, and the Google Mobility showed that we were practicing voluntary lockdown, staying at home without a stay-at-home order. Okay, and according to the daily onset data, it showed that every week we have the periodic low number of instances every week. It showed the effect of the quasi lockdown by our people staying at home. 1 week later, you will see fewer cases. And actually, the commander continued to say he did not want to do lockdown, and he said last year, May 30, he said it could not be zero even with vaccines. So give up that hope of zero COVID. Last May, he said, give up, no zero COVID, impossible. And a lot of people were helping him to say, oh, it should become like influenza. Okay, but our people didn't like it. And for expanded testing, I have mentioned that actually they set up community venues to do a testing. And you can see at the beginning, actually the test positive rate was very high, higher than 10% in Taipei and higher than 5% in New Taipei. And it lasted for several days. And every day I shouted in TV, I said, it's too slow, you have to do more testing. You were not cleaning up rapid enough, so you are culturing the virus. And I expand the testing services. So you can see actually 10 days, only 12,000 tests offered. Not so many, not as many as what's been done in China, but still, this slide showed you that as long as you did and you continue to do, still the case number went down. Okay, and actually later on, some communities in southern Taiwan, they suffered from the outbreak too, but that was detected early. For example, they found several cases within a building or several cases within a village. Then they practiced lockdown plus universal testing for that whole building or for that whole village. So we were learning to do things earlier and better. Okay, and you can see actually that this is the test positive rate. It's very, we only test the 10 case to find the test 10 people to find one case. It's just showing you how lousy we were doing very restricted number of testing, but still it worked. Why? Because you continue to test and you do contact tracing and you quarantine those who might spread the virus after a few days. So we were blocking down the spread. So as long as you continue to work, it will work. Okay, and the daily testing volume was still low. We hope the government can improve the testing capacity. Okay, and we did not prepare resources for patients because we enjoyed zero, zero, and zero every day. So the government did not prepare adequate medical resources to take care of the patients. So they had to be placed in the hotels. But even though they were not placed in the hospitals and the case fatality rate was very high. However, placing them in a hotel is still better than leaving them in the whole household or communities. Okay, so even we did not do the best job, still we tried to isolate and isolate and isolate, and that's very important. Okay, and vaccination rate at that time, 0.39% only. Okay, so it's not the vaccine to protect us, it's those non-pharmaceutical public health interventions that worked, and the case-based intervention detect. And the very, very important thing is to be followed by isolation and quarantine. Very, very important. And we were so poor. Most of our vaccines were donated by our NGOs. You can see our government did a lousy work. Okay, so, and eventually it turned out the case fatality rate, the mortality among cases were very high. Previously, it was only 1%, but then it went up to 5%. It's even higher than most countries in the world. And why? Because there were, we call it black number. We have so many cases not identified. So the case number was underestimated. And plus, we did not have good medical resources to take care of our patients. So you can see actually more than 50% of our cases of those who died within 4 days after diagnosis, or even die before the diagnosis. Okay, So at that time, actually, a lot of people died, and they died too soon because we did not have adequate testing capacity, and many just died before they were diagnosed. And actually, the excess death rate at that time actually is 15%. 15% excess deaths, about 5,000 extra deaths, not only 843. The 843 is the number of the government document of people who died from COVID-19. But in fact, we have 5,000 extra deaths. And among the 5,000, some died from COVID-19, some died from medical displacement. Okay, and we continue to criticize and to ask to push the government to do more. And I was criticized as those people, those Dr. Chiou who might be happy to get a commenter down. No, we look awful, we look tough, but it's because we would like to push the government to do better. And actually we have those grassroots voices, like the voice from the 2 mayors and some politicians who continued to criticize our weak points and to ask our government to do better. And actually our people were dissatisfied regarding the control of the outbreak and were unhappy about the government's effort in securing vaccine supply. Okay, but so this is the publication from the WHO independent panel saying that there are 3 things very important. One is border control. One is the population-based interventions. The other is the case-based interventions. But it's important to have political commitment and preparedness and scientific inputs to make these things happen. So you can see that at least during last 2 years, but then I will show you things are changing recently. Previously, our people prefer zero COVID, and local governments, they did a lot of hard works to help eliminate all those infections. And the 2 mayors, they have high political wisdom to harmonize their decisions so that they can work against the commander to save people's lives. Okay, and so although our testing capacity was very limited, we also had low vaccination rate. We had inadequate medical resources, and we only had how do you pronounce that? Quasi lockdown, not the hard lockdown, only quasi lockdown. And so, but still we got to zero, but it took a longer time. When we didn't have adequate resources, and then it took a longer time and we suffered longer, but eventually still we got there. And so I think what matters is the orientation. Do you want to go down or you allow it to go up? That's the difference. Okay, and actually elimination works, it continues to work under Omicron. I will show you. This is the curve of our after November 1st last year. So it's the Omicron era, okay? And under Omicron, actually these case numbers mostly were imported cases. We had breach in the community, but we continued to advocate for elimination, and the governments did better this time. And they try to make the curve low, to bend the curve, keep it low. Now that, and New Zealand is suffering a lot. So you can see Taiwan and China probably the only 2 current names in the world. And unfortunately, currently, after a lot of people get vaccinated, and currently 1/3 got their booster. So 57% before our Lunar New Year holiday, they say they can accept to live with the virus. Oh my goodness, you can see my work is more and more challenging. And only 1/3 say they still would like to keep it zero. And because people thought it's almost impossible to eliminate Omicron, so they say they can accept to live with it. However, then after this is January 26th, I continue to write a lot of commentaries. And January 26th, I wrote this. I said there were 3 myths. And one is Omicron is mild. That's wrong. I said, according to the case fatality rate of UK, if that happened in Taiwan, we will have 40,000 to die. And that's only next to the total number of deaths from cancer. So that will, Omicron can become the second leading cause of death in Taiwan if we want to live with it. And second, I say, people's elimination is impossible. I say, whether it's possible is not important. What's important is whether you want to do it or not. And third, people say we need to choose between lives and economies. I said, no, they were linked together. If we lose people's lives, then we will lose the economy. So I continue to push very hard about it. Okay. So if you ask me, then how long do we want to close our door against foreigners? I will say, oh, let's see what's outside of the door. Is it a tiger or is it a cat? And I said that in the TV. I said Omicron is a smaller tiger, but still tiger. And Omicron is smaller, but there are more smaller tigers, although smaller, but more, many more tigers outside the door. So I say we should better keep our door. But in the future, if it's truly a cat, then perhaps that will be fine. But that's also possible that, like New Zealand, if it's unstoppable, then I say we really had to increase the testing capacity so that everyone who would like to test can get a test, especially children who were not vaccinated yet. And also for high-risk people, they should be offered the treatment drugs. But actually, the Taiwan government would not be rich enough to offer these tools. So I tell them to continue your efforts to close the door against the tigers. Okay, that's my sharing. Thank you for listening. Let me, okay.
Thank you very much, Shu-Ti. That was really interesting, extremely informative. I'm sure we've got lots of questions for you. So could I ask people to put up your yellow hand, please, if you've got a